Okay. Dr. V, can you just state and spell your name and give your title for the reporters who might be watching this?
Yeah, Renuga Vivekanandan, Renuga Vivekandan, Chief Medical Officer for CHI Health, as well as an infectious disease physician.
Okay, thank you so much. And obviously, we wanted to just record this briefly because you had limited availability today, and we just wanted to be able to send this information out since we've been getting several questions from reporters about this topic. So we're talking about measles. Can you just kind of give us an overview of what we're seeing right now across the country? It looks like according to the CDC website, we've got 164 cases in 9 states. So can you kind of talk through what we're seeing?
Yes, thank you for asking. So, usually we do have some cases in the United States yearly. Last year, there was about 285 cases for the whole year. What is concerning this year is that within the first 2 months, we already have 164 cases. So we are, we still have 10 more months to go. So there's still, a really high number of cases that is happening in the US currently.
And why, can you speak to why we think this is happening?
Yep. So measles vaccines are usually given as a child, so about 12 to 15 months of age, and then they get a booster when they're 4 to 5 years of age. So that really protects our children. And then usually when you get vaccine, it protects you for lifelong, especially from measles. So when we have these outbreaks, what is common is that communities our vaccine rates are much lower. So when the community vaccine rates are much lower, there's higher risk for the individuals to acquire the infection and also to spread the infection. So most likely that is what is happening currently: lower vaccination rate, lower immunity, so higher rate for spreading the infection.
So can you speak to what the vaccine guidelines are? And I know there's 2 doses, so just kind of when a child should be getting this, the protection it provides, and all of that information.
Yeah. So CDC vaccine schedule for measles, mumps, and rubella MMR vaccine, they recommend between 12 to 15 months of age. And then you get a second dose between 4 to 6 years of age. That is the current recommendation for our children. And once you get those 2 doses, you have immunity for the rest of your life.
Okay, thank you. So if parents have questions about the vaccine schedule or the doses, obviously we would recommend that they talk to their doctor. But if there's concerns there, what's the best advice that you would have, or just the messaging that you would share?
Yeah, as a mom of 2 children, 11 and 9 year old, I always talk to our pediatrician, and she has always given great advice, looking at the data, looking at the vaccine schedule. So I think that's the best resource: talking to your primary care provider, family medicine doctor, internal medicine doctor, pediatrician, your advanced practice provider in any of the specialties, but just making sure that you're talking to your primary care provider and getting that right information so you can make that decision for your children, and getting the right information.
Thank you. And obviously, we did see the really sad news that there was a death reported this year. Obviously, that's news that doesn't feel good for parents to see. And so if their child is vaccinated, is this something that they need to be overly concerned about? What signs and symptoms should they look for? Can you speak to that?
Yeah, so usually once you're exposed to measles virus, you have about after exposures within the first 7 to 14 days, you'll start developing symptoms. Initial symptoms can be high fever, cough, running nose, red watery eyes, and you could get a rash sometimes as well, bumps. But with all of that said, you know, some uh, some symptoms are very mild, like ear infection or diarrhea. But what we worry about is if you're not vaccinated, you could get really complicated things. And usually complicated infections happens if you're 5 years and less, adults older than 20 years of age, pregnant moms, not only the mom, the baby can be affected, and patients with weakened immune system. So let's say you're getting chemotherapy, you've had cancer. So any of those things puts you at high risk for measles disease. So once that happens, some of the concerning things that can happen is you could get hospitalized. Even during now, there are many patients that have been hospitalized during this outbreak, over 30 out of the 164. You could get pneumonia. You could get encephalitis, which is an infection complication in the brain. You could have death from measles, just like the sad case that you just mentioned, Taylor, and lots of complication during pregnancy. So these are all avoidable and preventable if you're able to get vaccinated. And if you're not vaccinated, making sure you talk to your primary care provider to be able to obtain the vaccine.
And if you're not sure, I know a lot of people might not have their vaccination records from when they were children.
Yeah.
How can you, I guess if you're worried about it and you don't know if you've had it, what's your advice there?
Yeah, usually, reaching back out to your primary care provider would be the best option, or, and then, we have centralized immunization vaccination records as well. The health system that you are in might have that information. So I think just talking to your primary care provider to start getting that information would be a good idea.
Is there anything else that you'd want to say just about prevention and vaccination or, what people should know?
Yeah, there's a lot of information out there about vaccines. But I always reiterate and kind of encourage our patients to just like myself, talking to a primary care physician and getting the proper information and making that decision with the primary care information provider. Just like as a mom, I am, my children are vaccinated for measles. Data shows that it's very effective in preventing the infection. So, we don't want sad cases like that just happen in Texas. So I know, and thinking about human kindness and making sure we vaccinate and prevent the infection from spreading or getting in the first place would be the best idea.
Thank you so much.